Thank you for staying with Sharaad and I on Consider This. The popular image of the undocumented worker is of people who have sneaked into the country using rat holes or jalan tikus. This imagery has been popularized by politicians and some segments of mainstream media. Now, in a recent opinion piece, our next guest argues that the magnitude of the problem suggests that the issue cannot be reduced to the gaps in border control. According to some estimates, we have 4 million foreign nationals who are undocumented, making their inclusion in a public health response to COVID-19 both critical and difficult. Joseph Paul is a case officer with the workers' rights-based NGO Tenaganita. Thanks for joining us tonight, Joe. Can you walk us through what you think are the root causes of what you refer to as undocumentedness?
Okay, thank you for having us. The problem of undocumentedness, a term that I find this day, really goes back to a number of reasons. Mainly, I would put them as corruption and cheating and fraud. Fraud and cheating by agents and corruption on the part of authorities. By authorities, I know. You know who I mean, people who are involved in issuing visas and work permits. Now, let me just give one or two examples. Now, we have come across a large number of employers, or pseudo-employees, or bogus employees, I'll call them, who bring in thousands, hundreds and thousands of workers with calling visas, with valid papers, and then they leave them here stranded, without jobs, and without work permits. So the question that we need to ask ourselves is, how did these agents, masquerading as employees, get the quota to bring in these workers when all they have, and these employers have, are just the proverbial $2 companies? So now, we don't have much time to go into details on this, but having brought them in, what do you expect these workers to do when they find themselves stranded? Do you expect them to pay a huge penalty to the government, to the immigration, and then buy their flight ticket back home and go back to just what? Huge debt that needs to be paid.
Joseph, can I interrupt you at that point? I understand where you're coming from in terms of maybe a large portion of the undocumented, but would it be true to say that some people think that many of the undocumented also have gamed the system, perhaps in collusion with corrupt officials, in trying to extend their stay here and make a living?
Yes, that is true. It's not that they do it directly. There are agents who work for them as well as for these corrupt officials. Because we have come across cases where you have passports that are stamped with very impressive-looking visas and extensions and stuff like that, very official-looking documents. But when it's taken to the immigration, when it's time for them to go back, for example, they say this is fraud. Now, the thing is this. When these workers get wrapped up in this, and another thing is this, very often these workers do not really even know that they are actually fraud at the state. So they are paying good money and they're told that, look, we are getting you genuine documents. And honestly, they really believe that. Now, so when the immigration authorities then find this, other immigration officers find this, they don't seem to be interested in finding out who is it that issued this document, these kind of fraud, fake visas or fake documents. They're only interested in detaining the migrant workers. So, of course, you do not expect any kind of drop in this kind of cases. The workers are scared to go.
Okay.
and own up maybe. Yeah.
Well, Joe, the idea of getting the buy-in of foreign workers, both documented and undocumented, is key to us keeping or breaking the chain of infection, keeping those COVID numbers down. How do you suggest we build trust, especially since there seems to be a trust deficit, especially in the past week or so?
Yeah, of course, you build trust by keeping your word. And that has not been done. Okay, you told the workers, you come forward, come to be treated, and we will not take any action against you. And then within a couple of days, you do just the opposite of what you told them to do.
Right.
But I would like to go back to a little bit a more fundamental question, in the sense that, in this fight against COVID, we seem to have found a very convenient whipping boy to blame for the mess. And that popular attention is now focused on migrant workers, as if they are somehow responsible for a large part of the problem. Now, the tendency now is to stigmatize the migrant workers without really thinking it through and thinking how exactly have they contributed to the problem. Now, you can somehow argue that the migrant workers were responsible for other diseases like hepatitis or maybe tuberculosis to some extent. I don't fully agree to that. But COVID is something that has nothing to do in the first place with migrant workers. It was Malaysia's gift to them. They got infected here. So, of course, there are you can find clusters of, COVID positive, migrant workers, maybe in countries or in the high density accommodation. But is it their fault? Did they also generate this COVID virus? No, definitely not. And
Joe,
even if it's not...
Right, Joe, sorry, we have less than a minute left. I just want to ask you, but knowing that, because we've gone back on our word, as you said earlier, is there still hope to build bridges with this large community of undocumented workers so that the message gets out and we can start doing something positive for that community so that everybody is helped?
I think there are two things we need to do then. One is, of course, stop stigmatizing them. And number two, we should put an immediate halt on arresting, detaining migrant workers for all this administrative immigration fault. Because then they would be, then they would be prepared to come forward to be tested, if at all testing is the only way of dealing with this problem. And I maintain it is not, because we need also to look at where they live, the conditions in which they live, and we need to look at it in the long term, because testing is not going to solve the whole problem.
Agreed. As highlighted by many medical experts. Thank you so much for speaking with us tonight, Joe. That's all the time that we have for you on this episode of Consider This. I'm Melisa Idris. With me, Sharaad, Kuttan, signing off for this evening. Thank you so much for watching and good night.